Hello students, today I am discussing diabetes part 1. In this part, basically I am discussing what is diabetes, types of diabetes and causes of diabetes. Welcome back once again in your biology class. This is Nowsin and you are watching your most favorite channel, Educational Support. So my lovely students, are you ready? So let's get started. So first is, what is diabetes? Did you know? Yes, you are right. Because diabetes is the chronic disease marked by high levels of sugars in the blood. Dietary factors such as sugar-sweetened drinks are associated with an increased risk. The type of fats in the diet is also important, with saturated fat and trans fat increasing the risk and polyunsaturated fat and monounsaturated fat decreasing the risk. So eating white rice excessively may increase the risk of diabetes, especially in Chinese and Japanese people. So lack of physical activity may increase the risk of diabetes in some people. Actually, diabetes is a group of metabolic disorders. Next is types of diabetes. So there are two main types of diabetes. Number 1 is type 1 diabetes and number 2 is type 2 diabetes. So what is type 1 diabetes? Type 1 diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin to properly control blood sugar levels. So what causes type 1 diabetes? Did you know? Type 1 diabetes results from failure of the pancreas to produce enough insulin due to loss of beta cells, and this form was previously referred to as insulin dependent diabetes mellitus or IDDM or juvenile diabetes. So the loss of beta cells is caused by an autoimmune disease. So it causes approximately 10% of diabetes mellitus cases in North America and Europe, and most affected people are otherwise healthy and of a healthy weight when onset occurs. So sensitivity and responsiveness to insulin is usually normal, especially in the early stages. So next is prevention and treatment of type 1 diabetes. So type 1 diabetes must be managed with insulin injections. Next time discuss what is type 2 diabetes. So basically, type 2 diabetes is a disorder that is characterized by high blood glucose in the context of insulin resistance and relative insulin deficiency. So what causes type 2 diabetes? So type 2 diabetes begins with insulin resistance, a condition in which cells fail to respond to insulin properly. As the disease progresses, a lack of insulin may also develop, and this form was previously referred to as non-insulin dependent diabetes mellitus or NIDDM or adult onset diabetes. So the most common cause is a combination of excessive body weight and insufficient exercise. Basically, type 2 diabetes is primarily due to lifestyle factors and genetics. A number of lifestyle factors are known to be important to the development of type 2 diabetes, including obesity defined by a body mass index of greater than 30, lack of physical activity, poor diet, stress and urbanization, etc. So next is prevention and treatment of type 2 diabetes. So prevention and treatment of type 2 diabetes basically evolved in maintaining a healthy diet, regular physical exercise, a normal body weight, and avoiding use of tobacco. Type 2 diabetes may be treated with medications such as insulin sensitizations with or without insulin, Control of blood pressure and maintaining proper food and eye care are important for people with the disease. So insulin and some oral medications can cause low blood sugar level. So weight loss and surgery in those with obesity is sometimes an effective measure in those with type 2 diabetes. Thank you for watching. Thank you for your support. Make sure you hit the subscribe button and click on the bell and turn on the notification. So tata, bye bye, see you in the next video.